We are here to go into 3 thematic areas. The first, SG Goal 1, which is the poverty side, then SG 3, and then SG 4.
Adolescent death. For 2019, we have recorded 81 out of 1,000 population of those in the target group. 2020, 84. It's on the rise. Here, it is not exactly. If you look at assisted pregnancy, you may get a picture wrong because it has to be categorized by age, 19 and below. But the truth is that a number of them too are legally married and they have conceived. So such people will conceive, but because you are using age as an issue, you are categorizing them as such. On the international health regulations, the district is happy to announce that almost all the committees in place are working.
Please, on the HIV positivity. Nationally, we are 1.6%. That is the rate of prevalence. So every 100 people, 1.6 of them are expected to have death infection. When you come to our district, because we are not even able to test majority of the people that are in the district, we are 0.02%. So the 25 procedures, that is an absolute figure. But regionally, we are 2.6%. That is Upper East. Nationally, is 1.6.
The overcrowding in our schools actually is a big challenge. Some of our schools, not all, and you know, these are people are looking for quality education. People are looking for quality education. And the standards are very limited for economic our schools. As I told you that in some schools, we have only 3 classroom blocks for KG1 to primary 6. So what they do is that they will pair P1 and 2 together, pair P3 and 4 together, P5 and 6 together, and then KG1 and 2 they are put together. So you see that some of them they have to even go and sit under a tree.
Before coming, I heard so much about the constituencies. They are not too different from mine. They are very rural, they are very traditional, and appreciation for education is on the low side.
One thing I've seen is that there's a lot of data gaps that exist within the district assembly, and there's no well-coordinated program that pulls the data from the education, health, and that of the district assembly.
Some of the data they shared with us, even though it wasn't worrying for me, I'd wish that it was better, that over the years, the interventions that have been coming for girls and the youth and women in these communities especially, one would think that we will start, getting the fruits of those investments. But it looks to me like the issues are still there. So perhaps we need to reconsider the ways in which the interventions are planned.
You could see that it was a well-structured presentation, and so the interventions were very minimal. I think that whatever we have done here, if we are not able to articulate them when we return to Parliament, then it will mean that we have come to do an exercise in futility.
All in all, it was good. And then I'm very happy that this is the first time I've experienced this as a DC. And I must say that I'm very happy that this particular exercise took place. It is going to help us now align almost all our programs channeled towards that particular development goals.
It's a committee that is intended to make sure that at least poverty is reduced, if not eliminated at all, to the barest minimum in Ghana. And how do you do that? I mean, because of our decentralization nature of our governance, it is necessary to involve the assemblies who are directly with the people at the local level.
We have a total of 24 facilities, 3 health centers, 1 is a church, clinics are 2, 1 is private. Facilities that are conducting deliveries are 10. We have 20 functional checks. 11 of them have compounds, and then 1 child facility. Medical assistant to population ratio, that time we have 4:10,635, while nurse patient ratio is 1:449. With midwife, we have 1:2 in each facility. Maternal mortality ratio, we've been recording 0 over the period. It was only in 2018 that we recorded 1. Since then, we've not recorded any maternal mortality.
As teachers, we also try to make the teaching and learning environment friendly so that our learners will be able to operate. We know that in terms of infrastructure, that goes beyond the teacher, that is with government and assembly. But as to using the right leadership skills at the school level, which will be welcoming to accept our children in the school, we have been emphasizing that with our teachers so that they create a conducive environment for our learners to learn.
We want to do a little bit of revenue performance, and that one we're limiting it to 2021, how we perform as at mid-year. Now, out of a total of 7 million budgeted, as at mid-year, we had realized 2,438,000. We realized that IGF of a budgeted 75,571 Ghana cedis, we had realized 15,114 146 Ghana cedis. The CWSA, Sustainable Rural Water, we had realized 7,000 out of 35,000. The DSCF RFG, or the DDF, we had budgeted for 909,000, and we had realized 1,200,000.
We were being supported to carry out free health insurance registration for all NIP household members. Which was done. We started in February 2021 and we ended in August 2021. Within this year, we were able to sensitize 130 females and then 91 males. They are those who were able to reach out to sensitize them on sexual and gender-based violence.
And then the issue of aquaculture, one of our community, that's how we know. There was a facility there, but through the assembly and then the department, we were able to put the facility back to use, and currently is benefiting the community.
This year, the whole region, there was no fertilizer. It's going to affect poverty in the area. It's going to enhance or make poverty reduction worse. I expected as a Greek officer, you talk about either there was no fertilizer or it came late, or the pricing was said the government had made interventions. It comes, it goes across, or it doesn't come at the right time, and the rest of them.
Your tilapia that you have mentioned, do you have readily available market for the person doing the tilapia? If not, they will pose harvest losses.
I'm most grateful for this poverty elevation reduction committee meeting. It has been a useful one to the district because all members of the assembly, heads of departments, they are all in, and other widows and orphans ministry and other dignitaries from the district are all present. We'll be able to discuss lengthily and we have known where to start and end.
We have a total of 51 primary schools with KG attached. That is public schools. We also have 5 independent KGs. We have 2 primary schools with our KGs, and then 30 junior high schools, making a total of 89 public schools. Then when it comes to the enrollment of our KG1 people, in 2020, we enrolled a total of 1,771 boys, then girls 1,674, which makes a total of 3,444. We have seen that there is a reduction by 219 in 2021, and we attribute this to COVID-19. In this year, we have 38 of our girls pregnant, and 9 are back to school.
That is girl-child education. You realize that all the years through, enrollment for boys is more than that of girls. And if you juxtapose that against the population of Ghana and the dynamics of the population of Ghana, you realize that women or girls constitute 51% at least of our population.
Builsa North is here. So everything here is for Builsa North. And you realize that 2014-2015 academic year, you had an abnormal gross enrollment. And that is the abnormal gross enrollment. So it was higher than any of the districts. But that was just for that year, 2014-2015 academic year.
In terms of health infrastructure, we have, for 2020, we had, during the latter part of 2020, we had another hospital coming on board in the municipality. That is a Chak hospital, St. Lucas Hospital, located at Wega. So we now have 2 hospitals. As at 2020, we had 4 doctors serving in these hospitals. By 2021, as at half year, it has been reduced to, as at now, to 3. In terms of helping to achieve the universal health coverage by sending health services to the doorsteps of communities, that is the CHIPS concept. The municipality demarcated 40 CHIPS zones in the entire municipality. And out of these 40, in 2020, 28 of them were functional.
You did not mention how many nurses you have in the municipality. So let us have an idea about the nurses.
In terms of general nurses and community health nurses, we don't have any problem. They are enough for us. Though some go to school, but every year we are being replenished.
MCs and DCs that we met were very much appreciative of our visit and our ability to give them an eye-opening of certain things that are expectant of them in a way to also push for some crafting of strategies and policies to be able to push in a way of improving education, improving health, and also reducing poverty. We are very much optimistic that by the time we are done with this report and submit, and when these policies are developed, we are very much optimistic that the results would ensure that improvements would happen in their life, and also educational standards will be improved and health issues would also be addressed.
I'm most grateful to the Parliamentary Select Committee on Poverty Reduction and ASEPA for organizing this forum. It's an eye-opener, and I will encourage my outfit to do this once in a while.